Hello, I'm Heather Craig. I'm the PA for Dr. Garrison. Can you tell me your name and date of birth?
I'm Stella Craig, 9/10/38.
Okay. And the reason we're meeting today is to discuss your total hip replacement. Can you tell me when the pain started and how bad it is today?
Well, it started actually about 2 years ago, and it gradually got worse. And today I walk, when I bear weight and I have pain, I use a cane, and when I'm walking, the pain is about 5 out of 10.
Okay. Can you tell me about your family medical history?
Yes. My family medical history is largely associated with cancer of just about anything. Personally, I have hypertension that's controlled, but there's no other heart disease or lung disease or kidney disease in my family.
Okay. Can you tell me any kind of medications you're taking or your past surgeries?
Yes. I take medication now for hypertension, for arthritis, for a cardiac arrhythmia, which is SVT, not atrial fib or anything, and for anemia and for reflux. But everything's controlled, and I'll leave this with you. It's a list of medications and diagnoses, and
that'll be very helpful.
Surgeries.
Okay, and so Dr. Garrison's approach is an anterior total hip replacement, and the way he does that is he makes an incision in the front of your hip joint, and he moves the muscles to get a better look at your joint, and then he will remove the femur, the top part of your femur, and clear out any damaged cartilage. Then he will replace the top of your femur with the artificial joint, and he will do an x-ray to make sure everything's in place and where it needs to be. And then he will close the incision with either stitches or Dermabond glue. And then you will go to recovery for a couple of hours and then go to a room.
Okay. And I have a right hip replacement, and it was the same approach, which is why I'm here, because I know Dr. Garrison does that approach. And it went very well.
The recovery time is a lot shorter because the muscles are not disturbed, like with a different approach with the hip replacement.
Okay.
And in a couple of weeks, you will receive a packet from the surgery center that you need to fill out and return, and there will be a card inside for our joint camp, which will give you more information about your surgery, your recovery time, the approach, anesthesia that they have for options, and you can go to that. And then you need to get a pre-op workup from your primary care doctor, and then you will come in for surgery in 4 weeks. Okay. Do you have any questions?
Yes, Dr. Garrison or the surgery center will send the workup requirements to my primary care doctor?
Yes, ma'am.
Okay.
And Dr. Garrison will be in a couple minutes to see you and answer any more questions you might have.
Well, thank you very much.
Thank you. It was nice to meet you.
Okay. Pretty good.